Good afternoon. My name is Becca Warnick. I'm an RN, MSW student with Gonzaga University, and I've been helping Grace Clinic this semester with creating a HIPAA privacy and security training session for their employees and their volunteers. So I will begin my presentation. Who needs HIPAA privacy and security training? Members of the Grace Clinic workforce who handle protected health information, including all volunteers, need to complete this training within 30 days of beginning work at Grace Clinic and annually thereafter. What is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. What does that really mean to us? It limits how patients' health information is used and how it is shared. It gives patients control of their health information. It provides protection for the confidentiality, integrity, and availability of their health information, and it explains penalties for violations that are committed. Why is privacy and security training important? It outlines ways to prevent accidental and intentional misuse of protected health information, makes protected health information secure with minimal impact on staff at the clinic, shows our commitment to managing protected health information with the same care and respect as we expect of our own private information. And it's about doing the right thing. So what exactly is protected health information? It's patients' identifiable protected health information in any form, written, verbal, or electronic. Examples of this are documentation of a visit, lab results, billing invoices, radiology reports, histories and physicals, and patient identifiers such as dates of birth, social security numbers, addresses, and phone numbers. Why do we need to protect protected health information? Number one, it's the law. We also use it to build and protect the reputation of the clinic, to build trust between providers and patients. Patients are much more willing to share important information with providers if they feel that information is protected and they feel it is kept confidential. It's about building trust. Privacy rule. Privacy refers to protecting an individual's healthcare data. Privacy rule defines how patient information is used and disclosed. It gives patients privacy rights and more control over their health information and outlines ways to safeguard protected health information. The security rule means controlling confidentiality of electronic protected health information, storage of electronic protected health information, and access into electronic information. How can patient protected health information be shared? You must obtain written permission from our patients to share protected health information, except under the following circumstances: direct patient treatment, consulting physicians, other healthcare providers needing to use that information to treat the patients, justifying payment if insurance is involved, some administrative, financial, and legal healthcare operations, public health authorities for reportable diseases, medical examiners and coroners, organ donation, and when court ordered to do so. The patient's rights. Patients have the right to receive a copy of the Notice of Privacy Practices at the first visit that discloses how the clinic uses and shares their information. Patients have the right to review and request copies of their records, both medical and financial. If information is believed to be incorrect, the patient has the right to request the information be corrected. And the patients have the right to file a formal complaint with the Department of Health and Human Services if they feel that their protected health information has been violated. How do we protect our patients' health information? We only access it when it's needed to do our jobs. When leaving your computer, always log off or lock the computer screen. Obtain authorization from the patient to share their protected health information. Lower your voice when talking about specific patients, especially in public areas. Do not share your computer password with anyone. Limit conversation regarding patients at the nurse's station, front desk, and in all other public areas. And shred documents that have identifiable patient information on them. Who should protect protected health information? You should, first and foremost, by following the organization's policy and procedures. All healthcare providers of Grace Clinic, including volunteers. Grace Clinic, through the Notice of Privacy Practices, and the federal government through HIPAA regulations. There are 3 types of HIPAA violations: incidental, accidental, and intentional. I don't think any of us want to intentionally violate someone's privacy, but we need to address all 3. Incidental violations are if you take reasonable steps to safeguard a patient's information. If a visitor happens to overhear or see that health information that you are using, you're not liable for that disclosure. Incidental disclosures will happen even in the very best of circumstances. The key is to make sure that we try and safeguard our patient's privacy. Accidental violations. If you accidentally disclose protected health information or provide confidential information to an unauthorized person, you must, number 1, acknowledge the mistake and notify your supervisor immediately. Number 2, learn from your mistakes and, if needed, help revise procedures to prevent it from happening again. Number 3, don't try and cover it up or make it right by yourself. Involve the people that need to be involved to make it right. Intentional violations are the ones that are the worst. We don't want to ever see somebody intentionally violate any of our patients' privacy rights. If you do not comply with HIPAA regulations and carelessly or deliberately use or disclose protected health or confidential information, you are subject to disciplinary action and civil or criminal charges. How do privacy violations happen? Simple ways: faxing documents to the wrong location. You should always double check the destination of the health information that you're sharing. By entering an incorrect medical record number, forgetting to verify the patient's identity when you're working with them, leaving a message on an unidentified voicemail, and throwing identifiable information in the trash can. Penalties for HIPAA violations can be very severe. Civil penalties can include fines up to $1.5 million per year for identical types of violations. You're not protected under any entity. You can be civilly charged individually. Criminal penalties include up to $50,000 fine and a year in prison for knowingly obtaining and wrongfully sharing information. A $100,000 fine and up to 5 years in prison for obtaining and disclosing through false pretenses. And $250,000 fine and up to 10 years in prison for obtaining and disclosing for commercial advantage, personal gain, or malicious harm. We never want that to be the situation of one of our volunteers, employees, or our patients. How are the HIPAA regulations enforced? Individuals. The public is educated about their privacy. Everywhere they go, that they're involved with a healthcare facility, they're given the Notice of Privacy Practices. They know what to do and they'll take action if their rights are violated. Office for Civil Rights. This agency enforces privacy regulations. They provide guidance and monitor compliance within healthcare facilities. The Department of Justice. This agency gets involved in criminal privacy violations. They are the ones that provide fines, penalties, and imprisonment to those offenders. In conclusion, it's up to each of us to protect our patients' protected health information. We should avoid situations where you could be at risk for violating HIPAA regulations. Use appropriate security measures to protect patients' health information and keep it confidential. If you don't need that information to do your job, don't access it. Remember to consider the patient's perspective. If this was your protected health information, would you want it to be used? Remember, it is your responsibility to comply with all privacy and security laws, regulations, and Grace Clinic's policies pertaining to them. Thank you.